Good morning, everyone, and welcome here today as I welcome Dr. Roussin here with myself as we share an important update on our next steps with respect to lifting COVID-19 restrictions here in Manitoba. The past 2 years have been incredibly challenging, I think, for all Manitobans. We all have had to give up something, and some more than others. Some have lost loved ones to this virus. Others have had to isolate from family, friends, and neighbors. Businesses have had to adjust their operations, close their doors, and lay off staff. Students, teachers, and parents have had to adapt to a virtual way of learning. Our children and youth have missed out on sports, on music, on other extracurricular activities. We've had to mask up. We've had to stay apart from one another. And we've had to roll up our sleeves to get those vaccines. We've had to forego birthday parties, weddings, anniversaries, and even end-of-life celebrations. Manitobans have put their lives on hold, and it's time that we give them their lives back. I want to thank all Manitobans who have been patient and sacrificed many things in their day-to-day lives. Today, we offer hope to those who have been waiting for a long time to see that light at the end of the tunnel. The restrictions have placed many burdens on Manitobans, and now that we see the pressure of our hospital system starting to ease, it's our responsibility of government to ease those restrictions on Manitobans. With key COVID indicators improving, we are pleased to announce that we are accelerating our plans to ease public health restrictions starting next week. Effective Tuesday, February 15th, all of Manitoba will move to yellow or caution on the pandemic response system. Effective Tuesday, March 1st, the required use of vaccine cards will be eliminated in Manitoba. And effective March 15th, mask requirements and all other restrictions will be eliminated. And for further details on these and other details, I will now pass it over to Dr. Roussin.
Well, thank you, Premier. Good morning, everyone. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. And so based on our data and our modeling, we can see that Omicron has peaked and is beginning to subside in Manitoba. All the indicators that public health considers are moving in the right direction at this point. And so just like many times in this pandemic, we've had to shift our response based on what we're seeing with the virus. And as a result of what we're seeing now with the trends and the modeling, is we are in a very important transitional phase for our COVID-19 response here. And again, we're going to shift our approach. And so this means that we can move forward with relaxing some of our public health restrictions next week, Tuesday, February 15th. So at that time, the entire province will be moving to yellow or caution under the pandemic response system. And one of the largest changes that people will notice is that we'll be lifting many of the occupancy limits from most places, including gatherings at private residences. So this will apply in spaces like restaurants, bars, indoor-outdoor sporting events, and casinos. Capacity limits will also be removed for outdoor public gatherings, but will be limited to 50 people indoors unless proof of vaccine is required. So proof of vaccination and mask requirements are going to remain in place for the next number of weeks. However, beginning on the 15th, those aged 12 to 17 will no longer have to provide proof of vaccine or recent testing to participate in indoor sports and recreation. So we're providing more detailed information today about other changes that will be in place next week. and to guide to your specific circumstances. So like the rest of the province, schools will be changing to yellow on the PRS. Masks will be required indoors for staff and students, but will not be required during physical education classes. Medical masks will be recommended but not required. Beginning next Tuesday, there will also be changes related to isolation requirements that start moving us from public health rules to public health recommendations, and more closely what we should be adjusting to in a typical respiratory virus season. So if you have symptoms or test positive COVID-19, you're going to continue to be required to isolate. We want to give yourself time to feel well and isolate for the minimum of the 5 days. But close contacts will no longer be required to isolate regardless of your vaccine status. If you live with someone who has symptoms and test positive, we're going to recommend that you self-isolate, but it's no longer going to be required under a public health order. For the next several weeks, proof of vaccination will continue to be required because this is a reasonable measure that keeps us safe. We know that it's really the tremendous vaccine uptake that we've seen in Manitoba that's gotten to us to this place right now, the ability to loosen our restrictions. And so it's still, with or without proof of vaccine, it's always going to be our message to get that vaccine that you're eligible for as soon as you are eligible for it. So this is an incremental plan, and we're going to continue to move that path from public health restrictions to public health recommendations. And so for many of you, it feels like these restrictions have been in place for too long, and for others might be apprehensive about our gradual reduction in these restrictions. But we know that from the very first public health order that we have signed, these were always intended to be temporary. We knew that this pandemic would come to an end. We knew that the public health restrictions would come to an end, and we are now on that path moving forward. So we continue to have a lot of tools at our disposal. We've talked about the fundamentals in the past many times, so we know we still want people to stay home when they're ill. We still want people to get vaccinated, to wash your hands, to cover your cough and sneeze. We know that as we eventually move to public health recommendations regarding mask use, that mask use is still available to Manitobans. If you're indoors in places where you cannot distance, we'd still recommend you consider wearing a mask. Just no longer going to be a requirement at some point. We are easing the restrictions on gathering sizes, but again, we suggest Manitobans consider the size of those gatherings that they'll have based on the risks of yourself and your guests. If you are at significant risk for severe outcomes related to COVID-19, if you're in an older age group, if you have underlying medical conditions, you need to be very cautious about the number of contacts you have outside your household. But again, we're moving to those public health recommendations rather than restrictions. If you have symptoms of COVID-19, even mild, and you're at increased risk of severe outcomes, get tested as soon as possible. We now have treatments available. We have monoclonal antibodies, which have been present for some time. We have Paxlovid, the oral treatment. What we're finding now is many people who would be eligible for treatment, they are testing positive and have underlying health conditions. They're testing too late. They're presenting longer than the 5 days after symptom onset, so our medication isn't going to be useful. So if you're at increased risk of severe outcomes, get tested as soon as even the mildest symptoms start, because we do have treatment options available now. So we are certainly turning the corner in the pandemic. It wouldn't have been possible without the tremendous work and tremendous sacrifices of Manitobans, the very high level of vaccine protection. And so at this point, we are starting that path to public health advice rather than restrictions, but we're going to do so in an incremental way and continue to follow those indicators that we've been following so long. So thanks again to all Manitobans, and I'm going to pass it back to the Premier.
Thanks, Dr. Roussin. It's because of Manitobans' collective efforts and your dedication, your compassion, your willingness to protect one another that we are here today and able to confidently move forward to lift public health restrictions. I said several weeks ago, and you'll recall, that we must learn to live with this virus. And part, I think, of living with this virus is mitigating our own risks and doing what's best for our loved ones. I'm vaccinated. My family is fully vaccinated, and I will continue to encourage as many Manitobans to get vaccinated as possible. But the choice to get vaccinated is yours. As a government, we have encouraged as many Manitobans to get vaccinated as possible, and we will continue with those efforts. But it's time for a new normal to begin in Manitoba. We need to end the divisiveness between families, between communities. We need to move forward. It's time to bring Manitobans back together again. I think today is a good day for Manitoba, and I'm confident that we will have many more great days ahead of us. There is great hope for a positive future in Manitoba, and that hope and opportunity, I think, starts today. Thank you. Ready to take some questions.
You talked about data, and the last time here, you said the data shows we could release restrictions. And with respect, neither of you released any data. We don't see the wastewater monitoring. We don't see the absenteeism reports you're talking about. You reference data again. Where is the data that suggests this is the proper course of action?
We'll release that data
When?
as soon as we can.
Yeah, I think I'm going to be out at my usual media availability next Wednesday, and I'll present it there.
Sorry, we're here now, and you're announcing this now. This is the second time you've said data supports this. This is the second time you've said that, both of you, without presenting data. Why not have that now? I even gave your folks a heads up today, saying I will be asking this question.
Yeah, we will release that data. If we can do it, we can probably do it sooner than that. Brent, I don't see any reason not to.
Dr. Roussin, did public health recommend the removal of the mask mandate, the removal of the proof of vaccination mandate on these dates?
Well, certainly we recommended the removal of all public health restrictions, the day we first issued them. We knew they're going to be temporary. So we're following, the data, and we'll release that. And we knew that all of these measures are going to be temporary. And so we had made some recommendations on what that could look like, various factors. And then looking at the data here, we've expedited by kind of a week compared to what we had before. These ones were originally going to expire on the 22nd. But from what we're seeing, we felt comfortable with moving it to this date.
But given the drain on the healthcare system and the fact that we still have ICU that is well over our normal capacity, did you recommend these changes on these dates?
Well, we recommend, we work with the healthcare system, right? We're in instant command, so we meet daily with that system, looking at that very capacity, looking at what our modeling tells us in the direction of it. So yes, we are recommending that incremental release of these. Again, cautiously, right? We're not doing it overnight. We're watching it, and at each step, we're going to continue to watch those indicators, remembering that the incubation period of Omicron is much shorter than some of those other strains. So that 2-week period gives us a number of incubation periods to watch.
Madam Premier, how much of this is political? People are going to look at this timeline that has been moved up and say that you're giving into the pressures of the protesters that are sitting outside the legislative building right now.
Not at all. What I would say is that this has been ongoing. I mean, Dr. Roussin said, I guess weeks ago, that we were looking at probably the spring, wherein we would be removing all the restrictions. And that was before protesters were out in, the front of the legislature. So, I mean, we have been having these discussions for some time. We've been following the data. The data is now telling us that the ICUs are on decline. The ICU capacity for COVID patients is on decline. The hospitalization capacity is on decline. So now it's time to, I think, safely move forward with the reduction of these restrictions. I think, you know, today is about all Manitobans, and all Manitobans who are tired of this pandemic, who want to move on, who want to get their lives back. You know, this is a day for all Manitobans.
What do you say to the protesters outside? We're seeing Doug Ford in Ontario today issuing a state of emergency. We have our borders that are blocked here at Emerson. We have people that are not leaving outside, that are planning another protest outside Boundary Trails Hospital on Saturday.
Yeah, what I would say, I have reached out to the Prime Minister, and I've asked for what is the plan and his plan moving forward to deal with this. It's nothing that's unique to Manitoba. Obviously, we're seeing it across the country. There needs to be some sort of a plan on the part of the federal government to ensure that we can have the movement of goods across our border, and that's not curtailed in any way. So I have reached out to him. I think he needs to reach out to President Biden as well, and look at some sort of a collaborative approach to this. It's happening on both sides of the border. And so we've done that. I have reached out to Governor Burgum as well of North Dakota. I will be having a conversation with him this afternoon to see how we can work together. And when it comes to the protests that are just outside the grounds of the legislature, it's obviously in the purview of the Winnipeg police, and I have been in touch with the mayor. And we will have ongoing discussions on that as well to ensure that we're taking a collaborative approach to this.
With respect, I got this
protest movement at all. They've asked to meet with you. Have you or Minister Gertson or Minister Friesen, who are representatives of the Southern Health Region where a lot of the protesters are from, have any of you reached out to meet with any of the protest organizers?
So I did receive a letter, I believe it was on Tuesday, from the protesters outside the legislative grounds. Obviously, we've been, occupied with other things here, looking at modeling, looking at the data to ensure that we can, safely put together a plan that to safely reopen Manitoba. And so I think, that's what we have been doing. Having said that, I'm not saying that I would never meet with them. It's just that, there's a lot of demands on all of our times. And I think what's important is that, and I want to thank actually the Winnipeg Police Service for the incredible work that they're doing, working with the protesters to ensure that things don't escalate to a point, that it's dangerous. And if it does, then we'll have to take some action, and we'll certainly work with the mayor and others out there. Of course, the Winnipeg Police falls under the city's purview, but we're working collaboratively, I think, on this.
We're seeing widening protests across the country, here in Manitoba as well, some with a hard right element that is, let's face it, are not here about vaccine mandates. People in every corner of Canada are disappointed at every level of government, instead of taking action, is pointing the fingers at the others, saying, well, no, it's their responsibility. You were just asked the question. You pointed to Trudeau, you pointed to Bowman. What are you going to do as the leader of this province to ensure that our economy is safe and that the goods and services flow? What are you going to do?
Well, I think finished saying what I have done. And, I think this has to be a collaborative approach to this. I mean, some of these protests are taking part at the border as a result of something that the Prime Minister of our country implemented. It's not something that's unique to Manitoba, but I haven't walked away from that. I mean, I am working with them. I'm reaching out to the Governor of North Dakota. I'm working with the Mayor, and we're going to work in a collaborative way through this.
Do you recognize that far-right extremists are involved in this?
With respect, to what's happening outside the legislative grounds, I think it's important to let the professionals do their jobs. That's the Winnipeg Police, and I think we need to have respect for what they are doing to ensure that it doesn't escalate. And that's what their job is, and they're doing an amazing job.
I'm not
But
talking
we saw
about
a
the
school
protests
targeted
here.
yesterday. We're seeing a hospital that's going to be targeted on Saturday. What are you guys doing to stop that?
So, listen, people have the right to, peaceful protests in our country. That's part of being a democratic society. And, but there needs to be balance, and there shouldn't be, people protesting in front of schools and hospitals and those places. And And certainly, you know, we did reach out. I know the Minister of Education and I, you know, reached out yesterday to ensure that, you know, this doesn't get to a dangerous situation. And, you know, we need to make sure that we work with the professionals, the officers who are trained to deal with these situations so that they don't escalate to levels where it's, you know, it's beyond control. And so I just want to thank all those officers for the incredible work they're doing to ensure that we don't get to that phase.
We're going to jump to Zoom now.
Now go to the Zoom call with reporters who will have one preliminary and one follow-up question. Up first this morning from the Brandon Sun, Kyle.
Good morning. Premier, you started off by talking about all the sacrifices that Manitobans have made throughout this pandemic. Are you concerned at all that by taking us out of these restrictions, perhaps prematurely, that you'll be subjecting us to more hardship in the future if we have to, you know, go back into harsher restrictions due to a new variant, or if the pandemic takes a nasty turn?
Well, thanks for the question, Kyle. And of course, we're making these decisions and developing these plans based on the data and the modeling that we've seen. And so we'll continue to move in that direction. These restrictions were never put in place to be there permanently. And I think Manitobans have sacrificed a lot in their lives. Many Manitobans haven't been able to see their loved ones. You know, children have been, you know, away from school at times. They've been away from their sporting events. You know, these are not easy decisions that have been made in the past, but they were necessary to protect Manitobans. Now it's an opportunity to move beyond that. And based on what we're seeing, I think we're very confident that this plan is put in place, you know, with incremental timelines. It's a plan for Manitobans so that they can plan for their future as well. So I think it's time for that.
All right, thank you. And have you guys discussed the possibility of instituting a state of emergency similar to what Doug Ford over in Ontario announced this morning?
So, I mean, again, I would go back. The RCMP is monitoring the situation along with the border patrol people, and I think we need to let the professionals do their jobs. I know that they have been in touch with the protesters. They have now identified someone who is in charge of the protest at the border, and I think we need to let the professionals do their jobs. When it comes to this, they are trained to de-escalate situations, and I know with in my previous time as the Minister of Justice, I worked with those law enforcement officers, the RCMP, the Winnipeg Police Service, and they do incredible work to ensure they continue with the safety of Manitobans. So we thank them for their work.
Thank you.
From CJOB, Clay.
Okay, can you hear me now?
Hi, Clay.
Hi. Dr. Roussin, we all know Omicron is quite contagious. Are you worried that these restrictions, a number of the restrictions being lifted, could cause a lot of people to let their guard down?
Yeah, and so what we see right now is that there's been a significant amount of transmission that has already occurred due to Omicron, and that wave has now peaked based on, you know, the amount of Manitobans that have been infected, as well as our very high vaccine rates. So the modeling that we're looking at, what we see has occurred in other jurisdictions. This is the appropriate time now to begin easing some of our restrictions, but of course following those indicators that we always do. That's why we're doing it in a stepwise manner. But based on what we're seeing here and in other jurisdictions, this is that appropriate time to start easing our restrictions.
Premier, is it your hope that easing some of these restrictions are going to end these protests?
Well, I think what this does is easing some of these restrictions is giving Manitobans more freedom in their lives. And I think that they have sacrificed a lot in their lives over the last couple of years, and I think many Manitobans have been waiting for this for some time. And I think this is about giving that hope and opportunity back to Manitobans again.
From CBC Radio Canada, Alexia.
Hi, can you maybe, I would like to know if the government intends to continue to have this extra capacity for ICU or return to pre-pandemic numbers of beds.
So I believe Minister Gordon will be going out along with Dr. David Mateer this afternoon to have indicate what is happening with respect to the ICU capacity moving forward with respect to surgeries and diagnostic procedures. So I know that Minister Gordon will have more to offer, and Dr. Mateer this afternoon on those issues.
Thank you. And will you look at the situation in Alberta and Saskatchewan after they ease their own restriction to maybe adjust hours based on their results?
So every province makes their own decisions based on the data that they have, and I'll ask Dr. Roussin to jump in here if he'd like as well. But we make our decisions based on the data and the modeling that we see here in Manitoba. Sometimes we look to other provinces to see if there's trends that we can learn from here, and if there are trends we can learn from, we can act on those. So those are always opportunities for us as we move forward.
From CTV Winnipeg, Michelle.
Hi, I just would like for you to tell us what are the benefits as well as drawbacks to accelerating lifting restrictions like this?
So I think when it comes to the acceleration of these restrictions, we make that decision, as Dr. Roussin said earlier, based on the modeling and the data that we see. And what we have seen is a fairly significant decrease in ICU, COVID-related ICU, and as well as hospitalization, COVID-related hospitalizations. And so we believe that because Manitobans have really sacrificed a lot in their lives, that as the hospitalizations start to ease, that we need to ease some restrictions for Manitobans as well, so that they can get back to living their lives in some semblance of normalcy.
Okay, so what thresholds are going to be used potentially if we need to bring these restrictions back? Because people aren't going to want them once they're gone.
So we continue to look at the modeling, and we're making these decisions based on the modeling that we see. I think that, I'd ask maybe Dr. Roussin to jump in here and make his comments on this, but we make our decisions based on the information that we have and the time, and we're very confident, I think, moving forward with this plan that Omicron is different from Delta, from other variants, and I think what we're seeing is that we're in a situation where we're confident that we can move forward with this sort of cautious and measured approach to easing of the restrictions. Some provinces have chosen to go much more quickly. We have taken what I think is a cautious and measured approach, and so that's what we see before us today.
Yeah, and so certainly we've done this before. We've loosened restrictions. Restrictions have never been what we've interpreted to be permanent. And then at times we've had to reinstate them. So I don't think anyone really wants restrictions in place, but when they were required in the past, we've loosened them when appropriate and added them back on if necessary. What we've seen now is that we have such a tremendously high vaccine uptake. The thought is that we're at a point where we can look to remove these restrictions outright and hope never to have to put them in again. But that's going to depend on what we see with the virus. Further variants are certainly not out of the question, and we'll have to deal with that as that arises. But we're not going to leave restrictions in unnecessarily just because there may be a time where we face this virus again.
From City News, Mike.
Hi, Premier. I know you were asked this already, but the timeline of pulling this press conference together, it does seem coincidental. 2 days ago, the new restrictions kicked in. The city just met to discuss these protests. Are you telling Manitobans who are going to be questioning this that it's purely coincidental that the timeline was accelerated as the protests continued?
Look, as a government, we don't make decisions that are this important to Manitobans based on protests that are taking place. This was not a decision that was made because of what's going on and protests that are taking place in the province. This is a decision that is made for Manitobans who have sacrificed much of their lives for the last 2 years and are ready for this. Manitobans are ready to get their lives back, and that's what today is all about.
Thank you. And my follow-up question is, you commended police for their work on this protest. Manitobans in the downtown area probably would think differently. There have been reports of verbal assaults, horns going off at all times of the night, people losing sleep, people who work night shifts losing sleep during the day. Can you just tell me exactly what you're commending police for, and if you think this protest should have been handled any differently?
So I commend the police for the work, the ongoing work that they do to ensure that things don't get out of hand and escalate to a point where, it's dangerous for individuals. But we need to have a balanced, respect for one another here. There needs to be respect for the rights of those individuals to protest in as long as it's in a, law-abiding way. And we ask for them to also, respect those people who are living in the vicinity and maybe think about those people as well and ensure that those people have the right to, live peacefully in their homes as well and not be disturbed in the middle of the night. And I think those are discussions that are taking place as a result of discussions between the Winnipeg police and those who are organizing the protest. I think, there was sort of an organized approach to that did happen as a result of those discussions with the professionals, with the police officers who are trained in this. And so, there needs to be respect on both sides of this for the rights of those individuals.
From CBC National News, Cameron.
Hi, Premier. On that point, we've been hearing from people around these protests, whether it's the protests downtown, the truckers at the border that can't get across the border, or people that have been held up by the slow rolling, that their rights have been infringed. And they've been infringed now for a long time. If you don't have the legal authority here, you have moral authority. Are you willing to use your moral authority to call for an end to the protests?
So again, I have reached out to the Prime Minister. It is his purview, under his purview, the border. And so, I've asked what is the plan to deal with this. We know that it's nothing that's unique just to Manitoba, but it is happening across the country. Of course, we respect the RCMP officers who are managing the situation at the border. They are the professionals here who are ensuring that I believe livestock is able to get through, that there are some truckers that are able to get through. But again, it goes to both sides. There needs to be a balance. A respect for those, who have the right to peaceful protest, but also those truckers who have the right to deliver those services as part of their job. And so, I have reached out also to the governor of North Dakota. I will be having a discussion with him this afternoon just to see what's happening on their side of the border as well. Of course, those, restrictions at the border were put in place as a result of President Biden putting those in place. And so I look forward to having those discussions. So we are, and I am acting on this.
People have been honking their horns at all hours outside of your office. People that live around it are sick of it. Is it not time to tell them to go home and follow the lead of other politicians in this country, including Doug Ford and now the interim Conservative leader? Has the point not been made, Premier?
I think they have made their point. There's no question. I think their point is loud and clear. But again, we need to let the professionals do their jobs to ensure that things don't escalate to a point where they get out of hand. And so I take the advice of those professionals, being the police officers who are there at the front lines, who are gauging what the temperature of the situation is on a minute-by-minute and hour-by-hour basis, and making decisions, that are in the best interest of Manitobans. I mean, but, I will ask those protesters out there to please consider, the livelihoods and the rights of those individuals who are living and working in downtown Winnipeg in close proximity to their protests. Think about those individuals and what it means to them, because they have rights here too.
From the Verdun Empire Advance, Anne. Hello, Anne.
Hi, can you hear me?
Hi, Anne.
Hi, yes, it's great to be on this call. Thank you. I guess I have watched from a distance, of course, this protest, watched some CBC footage and some Global and CTV, as well as citizen footage, some various smaller media as well. Why do you think, Premier, that this protest has grown so broad? What has brought it to this level? And how effective do you think it would be for our federal leader, Justin Trudeau, to come and speak to them, or for you yourself at our legislature to come out and address these people and do some mediation that way?
Yeah, I think, again, I think people have the right to peaceful protests, as long as that's what is happening and continues to happen. I think in other jurisdictions that is maybe not happening right now. And again, those professionals, the officers who are working, right there at the front lines are best to gauge the situation that's happening, right there and right then, and they will monitor those, and we continue, and we're in close contact. I know the Minister of Justice was out yesterday answering some of these questions. I know he's working diligently, his department, and working with law enforcement to gauge, where that's at, and I think we'll just continue to monitor the situation.
Thank you. It's good to hear from you. I'm wondering, do you have confidence in Manitobans to now take health seriously and to manage throughout flu season or a pandemic of this level? I mean, people are not dropping dead all around us. Have we got the wherewithal to just, stay home and we're sick, behave ourselves and go forward as the mandates are done?
Thanks, Anne. Listen, I have every confidence in Manitobans to manage their own health and to gauge what they believe is best for themselves and their families. And, and that's why I think the vast majority of Manitobans went out and got vaccinated. We had a very successful vaccination campaign here in Manitoba. And I think that, again, I think Manitobans are getting a little bit tired of the restrictions. I believe that they want to move on. I think they want to get their lives back, or some semblance of normalcy back into their lives. And of course, that's what we're here to do and announce today, and to give them their lives back.
We now return to the news conference theater.
The virus is still in the province. You're lifting mask mandates in personal care homes as well in March. What are you going to be doing to keep vulnerable people like those in care homes still safe, given that COVID is still out there?
Yeah, well, for the higher risk settings, like personal care homes, like healthcare settings, we're going to be working with the infection prevention control experts there. So just like at other times in the pandemic, there may be added requirements in those settings. So masks may still be required in healthcare settings and personal care homes, for instance. So there's still more to come on that.
Will vaccination and testing still be required in those settings for people who work there?
So again, we're not going to do anything unilaterally. We're going to work with those settings, but the idea, right, as moving forward, is that we are moving away from vaccine mandates, and so that is the path we're taking. When that exactly will affect those areas, we haven't come to that yet.
Dr. Roussin, are you comfortable with these changes that you've announced today, given the fact that the healthcare system really hasn't had a chance to have a breath? I know new admissions are dropping, but there's still people in those beds. ICU capacity is still well over the pre-pandemic normal. Why are these restrictions being eliminated in the coming weeks when the healthcare system is still not catching its breath?
Yeah, so I mean, there certainly is that strained healthcare system. It's come down from what we've seen in other settings. But again, if we frame things like that, we're eliminating what we know are tremendous negative impacts of the restrictions as well. So we always have to find that balance, right? So we've probably all know people who have been adversely affected by these restrictions. So we can't just focus on one aspect of the pandemic. We know the restrictions cause harm. We know that the healthcare system has been strained. We're looking for that balance, but we have to consider the adverse effects of these restrictions and do whatever we can to have the least restrictive measures in place.
Madam Premier, when I asked about extremism, I wasn't talking about this protest out here. This protest out here is cooperating with the police and has largely been in one place. But we are seeing widening protests at the border, in Steinbach, in other provinces. I'm going to ask you again, how concerned are you about a far-right, hard-right element doing things to undermine democracy in general in this country?
Well, Bartley, I mean, what I would say is that every protest is different, and if something starts to escalate to a point where people are doing things unlawfully, then we need to step in, absolutely. And we will monitor that as it goes forward. But I'm not going to give a sweeping statement about something that isn't reality that could potentially happen in the future. What we're seeing here is, and you just said yourself, what we are seeing is that the police are doing a very good job out here.
This protest. I was talking about the ones we're seeing at the border in this province, at the border in other provinces, surrounding and harassing children in schools, and the encampment away from the main one in Ottawa down there. We are seeing extremists at work here whose goal appears to be something far beyond vaccine mandates and pandemic restrictions. I'm just curious why you don't seem to be willing to acknowledge that.
I don't condone any illegal activity anywhere.
So you'll be cool if climate change or Indigenous protesters block the border in the future? You'd have the same approach?
I think if things get violent and they're not being handled appropriately, and again, I would rely on the professionals within those individual protests to see, what the situation is there. They are the ones that know how to appropriately de-escalate situations to ensure that people can protest in a peaceful way. And so I've said that time and time again, and I think I've answered that question.
Premier, what does the lifting of restrictions mean for those who had to either get vaccinated or get tested for work, like some healthcare workers? Is that going to be removed now as well?
Sorry, what's that?
The people who had to either follow a vaccine mandate or get tested to work, such as some healthcare professionals, is that going to be lifted as well? Will people be able to go back if they're not vaccinated without having to be tested?
Yeah, those details will be ironed out through the course of the next little while, but eventually, and what I've said weeks ago, is that, and other professionals or other, doctors and other politicians across the country have also said that we need to learn to live with this. And so what does that look like moving forward? We'll gauge those circumstances, but eventually we'll have to learn to live with this, where we're not imposing unnecessary restrictions because of one virus that's in the community. There's all sorts of other illnesses that we need to ensure that we're ready for, that our hospitals are ready for, and so we'll continue to gauge that as we move forward.
But that's not part of these, sorry, I just want to be clear, that's not part of these timelines yet. So as of March 15th, healthcare professionals will still either have to be vaccinated or get tested to go to work?
No, I believe that will be lifted, but we'll have those
Didn't you answer that question about vax requirements for people working with the vulnerable sector, and you said we're going to look at that?
We're still certainly the path we're on is to lift vaccine mandates. So this is speaking about the ones in the public sector where we are. If we're looking at the in those test or vaccine requirements, again, we're probably looking at similar timelines on that, but it's just not settled on right now.
And why not create a state of emergency? Why not? Brittany asked, you didn't quite answer that one, forgive me.
Because again, we are continuing to monitor the situation as it comes about at the border and at the legislature. And if we have to take action, we will. But for right now, the RCMP are doing their jobs very well to ensure that things don't escalate beyond where they need to be. Thanks, everyone.